And I know a number of you guys know him in person and might even be clients of his, which is great too. But well, first of all, Dr. Mitz, thank you so much for taking the time to be with us. I know being an equine vet, you have a very busy schedule and lots to do. So thanks for spending the hour with us.
Well, Jessica, thanks for having a show and thanks for having me on your show. So I look forward to it.
Awesome. So leading up to this, I read a bit about you and how you got into being an equine vet, but I think it'd probably be best coming from you. So will you tell us how you found yourself in this career and kind of like where you are today, what your career looks like today?
Absolutely. Thanks, Jessica. So my dad was a veterinarian. Growing up, I was always working with him, whether I wanted to or not. Working with family can be very challenging and very rewarding. So I believe you can work with your family, you can work with anyone. So growing up, it was a little bit of the James Herriot experience. We lived in slightly rural, slightly suburban Missouri near Kansas City. And much of my dad's practice when I was little, 5 or 6, probably 80% of it was large animal. And by the time I was graduating high school, probably 75, 80% of it was small animal. But I always had an affinity to the equine side of things. I had hoped to go back and take over that practice. And I know he had hoped for me to do the same. But as I got further into my education and more exposure to equine practice, I started to load up my time and my electives to go in that direction. And then once I came to Ocala in November of my 4th year, I fell in love with the area, the horse industry and the sport horse market, the thoroughbred industry, both of which are alive and thriving in this part of the world. And so I decided to do an internship to try to enhance my experience to take back home. And after a year here, I didn't feel like I could go anywhere else. And so here I stayed. I also went to a practice in Denver, but I love snow skiing way too much to be a good practitioner that close to the slope. So I never gave that any thought of going. And I haven't skied since because March is a busy time in Ocala. So spring skiing's done for me. But it's not a very crazy story, but it's been kind of a natural step to follow my dad's profession. And it's been so engaging and rewarding just professionally to be involved with so many people through offering horse care.
I love that. And Jessa and I, as sisters, really understand working with family. We understand that intimately. Well, Dr. Mitz, what is and I know you kind of touched on it, but what is your focus or specialty as an equine vet, or are you kind of like a general practitioner?
I'm definitely a general practitioner in the sense that since I've got into practice, I've just had the trajectory of wherever my clientele has taken me. I did a lot of kind of herd health and some reproduction early in my career. The 3-day eventers were quite seasonal in Ocala in the early 2000s. And so many of the more established practitioners didn't have as much time to offer them. And it was by luck that they continued to expand the eventing crowd expanded their time in Ocala. So that required more of me. And with that, expanded more sports medicine and some of the pre-purchases that we do and that you guys were alluding to in the questions. And so I've always tried to do what I feel my clients need of me. And so it's definitely drawn me down a path that is almost exclusively sports medicine and lameness evaluation, pre-purchase evaluation, and whether that be, like I'd said, I still do a fair bit of thoroughbreds, but early in my career, I did mostly thoroughbreds, and then that's definitely changed over to it's mostly sport horses at this point. But the disciplines translate well, and I have taken a lot of my sports medicine experience working on the middle-aged to older athlete in 3-day eventing, and it's translated well into early recognition of problems in our young thoroughbreds. And also, I appreciate the sales and the conveyance side of things, where people are buying and selling horses, and the importance of accurate, transparent information. And the thoroughbreds, the auctions are so vast, and there's so much volume, it's happening so fast that it's translated well for me into the pre-purchase aspect of the sport horse side of things.
That's really interesting. I bet you meet a lot of very cool people and very cool horses across both of those, kind of like the thoroughbred and now kind of more the sports medicine focus. That's very cool. So my first question I want to ask you is a bit of an icebreaker question. It's from somebody who I think is one of your clients, Genevieve. She said, "What's your favorite kind of treat or homemade baked item, just in case I need to bribe Dr. Mitts?"
Oh my goodness. All right. So I would say around the holiday time, I prefer one sort of pie, and the rest of the family, they have their opinions. I'm a part of I married into a large, close-knit family with sisters and cousins, etc. So everyone has their opinions, but I rarely get a pecan pie, and I definitely, simply because they always want the apple pie or pumpkin or more traditional things. So yeah, I always enjoy a good pecan pie, and there's lots of cooking and effort in my life at home and our family. So outside of equine practice, the kitchen's a great place to be.
That's the best. Yeah, I can't say I'm a pecan pie person, but I do think the people who do like it, it's like their favorite. So I understand the thought there. Okay, so the next question is, can you walk us through a day in the life of Dr. Mitts, or is every day different?
Every day seems to be different. As I've gotten further in my career, I mean, you just got to be ready for anything. You never know what's going to happen, what opportunities are going to arise, who you're going to meet, who you're going to talk with, who's going to need help, and to what degree that help's going to be. Is it going to be their horses? Is it going to be their health? Is it going to be personnel problems? Is it going to be, okay, you've got to talk to my other vet at home, you have to talk to the farrier, you have to talk to the agent that we're trying to buy this horse from, wherever. And it's it definitely, my day has evolved to, I'm handling horses less, and information, whether it be through imaging, x-rays, ultrasounds that are sent, conversations that are being had, and how people are interpreting things. Those are more my day than they were 15 years ago. I mean, 15 years ago, you had little idea what was going to happen. You had a few things in the books, and you were quite busy with maybe 25 or 30 small things. And now it's maybe 5 or 6 really big things that you've got people that have flown into town for. It's important to them, but it's important to them, and it's so important to them that it's very important to me that they have a good experience when we're there helping them work through whatever problem or new purchase they're trying to be a part of. So it does get back, Jess, to what you had said about, it's just the people in this. The common thread is the horses. It just will show you the world, and you'll meet so many wonderful people. I just can't say enough good things about the horse industry because of it. So to answer your question, the day is different. If it will ramp up pretty rapidly after the first of the year, and most of these things will be some performance issues, some disappointments if something's become acutely lame, or some pre-purchases, either on either side, buying, selling, etc. But the craziest days of the year are probably in September at Keeneland at the yearling sale, and all you can do is hope you've gotten enough sleep and taken enough sustenance to get through it. And you do it day after day after day. So I enjoy how things change up. I enjoy this time of year around the holidays and the expectation and excitement of a new year ahead of us for those competing. And those, if they're not in Ocala, as they come down this way. And then as the year goes on, it just cycles in and you kind of wind down and do it all over.
Oh, that's so interesting. I could ask 100 questions off of every one of your answers, I think, but our members would be angry with me. So one of our members, Lauren, asked, what's one thing that Dr. Mitz wished all riders or owners would be more educated in, and maybe something that he wishes they would do less of or stop doing?
That can be a little tough because I usually am working, I'm not trying to analyze what I wish they wanted. I'm taking the information they give me and working with that instead of being critical on what they do or don't know. The veterinary aspect is definitely a slice of the pie. It's not the whole thing. And depending on the program, it will be a slender slice or a big slice. And so it's my role to work through the veterinary aspects. And if I find physical things wrong with the horse that could translate into the complaints that have been raised either by the horse or the rider, then I will do my best to identify those accurately and how to proceed with a plan. I'll be slow, but as far as trying to be critical on what someone does or doesn't know, but if it's clearly, this is not a veterinary issue, or before we go down this rabbit hole, how about we pursue something else? Then it depends on the program. There are so many great professionals in this area that rarely is that the concern. And so oftentimes before we're pursuing treatment, maybe we'll go back to the professional, and those are kind of the team leaders, especially I believe in the adult amateur world. I mean, the strength of your team is crucial to your success and your horse's soundness and you getting what you want, which is to get around safely and within your capacity. So I don't know if that answers it, but I think there's a lot that goes into it. I think that's probably the answer. It's my role to assess the veterinarian aspect of things, but I will definitely interject if I think it's not a veterinary thing and you need to go back to the professionals. So what to learn more of, listen to those folks giving clinics.
Can you hear her, Dr. Mitz?
Not at all.
Oh, can you hear me now?
Yep.
Sorry, I didn't click the mute button, or I didn't click the unmute button. Okay, well, I was going off on a tangent. I'll be quick. Well, we had one vet on here, and I think her answer to a similar question was she just wants everyone to groom their horse before the vet arrives because it's really hard to do any work when there's like dirt everywhere, which I thought was a fair answer as well.
I have heard. So we'll go to Saratoga in August to a thoroughbred sale there also, and I talked to those guys, and they have to bring those horses in for 2 weeks to get all of the mud off in those New York breds in order to do spring surveys. So we don't get quite the haircoats down here. We don't have mud like they do elsewhere. So I feel fortunate to be where we're at. Always appreciate if you knock them off a bit before we arrive, but I'll work with what we got.
That's amazing. Okay, the next question is from Tanya. She said, if you could choose any one modality for regular use on sport horses, which one would you choose?
You have to identify the problem. And these things, different tissues will react differently and different horses react differently. So you have to have adaptability. If you are married to any one thing in this, you're going to go down in a ball of flames at some point. So, I mean, there's great chiropractors that can turn one around. There's a great farrier is an absolute necessity. A coach that will get in your mind when you're not mentally prepared to do what you need to do. That's important. So veterinary wise, we have a regenerative laser, we have a couple different shockwave machines. There's plenty of PMF machines out there, but all of them are utilized at different times. So if there was just one modality to grab, it would be simple, and it would have been done now, and there wouldn't be any discussion.
I saw that question come through, and I was like, I guarantee the answer starts with "it depends," because we've done enough of these episodes now, which is fair, but it is always interesting. It's even though it depends, it's interesting to hear what you all think. So our next question is, when you mentioned Keeneland, this question came to mind, and I found it really interesting. It's not something that I've faced before, but Hannah, who's out in Montana, said, when evaluating a weanling for purchase as a future sport horse, is there such a thing as a pre-purchase exam? She said, I'm thinking about things people usually look for in pre-purchase exams, like soundness or what the joints look like or the existing issues. And most of those things aren't easy to evaluate in a weanling and shouldn't be issues, assuming the weanling hasn't had any injuries. So what should a potential buyer look for in a weanling from a physical or health standpoint?
Athleticism and a good brain. And you have to start with those things. And those don't have anything to really do with the veterinarian. But there are certain horses are not biomechanically set up to be much of an athlete. And my clients are far better horse pickers than I. But at that point, you're basically, the veterinary aspect is you're looking for maybe congenital issues or early developmental issues such as OCDs, or injuries that would have occurred to the suspensory apparatus, such as sesamoid fractures or sesamoiditis. And so the pre-purchase exam of foals is important. You're not going to do flexions. They don't jog in hand very well. You should watch them move. You should watch them walk. I've found that that's more of an honest gait and way to assess a horse than I previously have given it credence to. You can learn a lot by how they place their feet and what they're doing. You can for sure determine how they are around unfamiliar circumstances and with different people, and a lot of that will translate throughout the rest of their lives and their demeanor. But as far as when I show up, it'll be let's do some things in the stall, whatever they'll allow. We'll look for some injuries physically, but just on the outside of the horse, but otherwise listen to the heart, look at the eyes, just look for anything, look for joint swellings, palpate these soft tissue structures, understanding that a lot of them will heal and change. So many of them will sustain a mild injury early in life that will have zero impact on this horse long term. And to bubble wrap them will produce a horse that's completely inappropriate for any sort of athletic endeavor. And so you want these horses that are raised naturally, somewhat in a herd setting. Maybe they have more than one or two people in their lives that handle them. And I think these are all important exposures for them to be willing to accept input from you and whomever else, the farrier, other vets that come along. So yeah, but you're left with kind of imaging. You don't have to do a bunch of imaging. You just probably have to do a few. You need to do a few shots of a lot of little things so that you know what you have. But aside from that, they'll change a lot, and they may acquire something in a month. Wasn't there when you got it if it was 8 or 9 months old, but that's what happens. The longer you have one, the more risk you've assumed as the owner, and the more opportunities horses have had to acquire injuries. And so you're looking for developmental things for the most part.
Absolutely. So kind of in the same vein, Grace is wondering, do you have any preferences in conformation? Specifically, when is there a flaw that would be considered unacceptable in your book?
Well, they are pretty well designed in the sense that they can come out with tendon laxity and weakness, and the most minor lamenesses can create abnormal foot growth and abnormal limb growth. And early detection is important, and identifying if there's a lameness, then addressing that and getting the horse sound again. I think there are a lot of angular limb deformities that can be managed quite effectively with regular and appropriate trimming. So in young horses, I think the blacksmith should be through every 2 to 3 weeks. And in reality, what happens is everyone gets busy and it gets to every 3 or 4 weeks, but they never go 6 to 8 weeks. And that's when the problems kind of arise. So to do a lot of correction on one is usually not in the benefit. You can create some problems. That's when you can get some wing fractures, you can get some sore horses, and they'll start to go around imbalance. So now you're taking much of the load and dispersing it among 3 instead of 4. And that's when you see sesamoiditis and suspensory problems.
Interesting.
I don't know if that answers all the part of that question, all the aspects of that question, but it's basically don't try to do too much to youngsters, because they oftentimes are on the path of whatever they're going to become, but just constantly do little by little and make minor corrections as needed.
So for the young ones, you said ideally a blacksmith would be there every 2 to 3 weeks. What age does that actually apply to?
On the mare through probably maybe 10 or 12 months of age.
Okay.
And then you're switching to once a month. And maybe it's nothing. Maybe they're not trimming at all, but they're just making sure these feet are matched up and they continue to grow normally. I don't think there's quite as many, if occasionally you'll have a club foot, you'll have a proper conformational flaw, and something that's too carpal valgus or too carpal varus or fetlock varus. I mean, these things that when the joints aren't lined up and they have a lot of concussion down the road, it will have some negative effect on their soundness as they grow. And obviously, if they're quite an athlete, then maybe it won't impact them that much. But if they need all their soundness, then it's those little things mean a lot. So
this is really interesting. I didn't know about this for horses that are that young, because I've never had a horse that young. But it brings to mind that a number of guests that we've had on this show, like whether it's a coach or a top rider, has said that good feet is something that's kind of non-negotiable in horses that they're bringing into their barn as rides for themselves. And I always thought that good feet was just the horse either has good feet or it doesn't. But if their feet are managed from a young age, like you're describing, and with a good farrier, could a horse be managed into having good feet? Or is what we're hearing from these coaches and riders more something that's like they're born with it or they're not?
Both, of course. I think there are horses have different qualities of hoof wall or horn that they grow. They have different conformation of sole, and so absolutely. But it is also biomechanical setup, and if we let the heels get away from them and the toe scoots forward, then you're in a constant battle. And I do see a lot of corrections put on young horses, and they're very pliable, and there's definitely overcorrection that can be created and torque of that hoof capsule that will affect soundness in the short term. Usually in sport horses, what's a young horse? 3, 4, and so at that time they're not quite as deformable as the foals and yearlings, but at that point there may be one of two things. It could be a proper conformational clubfoot, or it could be a chronic lameness where this horse has just been subtle and compensates and isn't doing anything, where he doesn't have He's not in a dressage test where it matters. He's running around the field and he's running around sound enough. And that imbalance in load will allow maybe more heel to grow on this one and squashes down the other one. So you get that kind of uppy downy foot.
Got it. So I'm going to transition us. We always get so many questions around joint injections. And I know it's hard for you to answer without seeing the horse. So we'll see how far we can get with these questions. So Erin O'Connor, she is asking, how do you choose the use of biologics for joint injections versus products such as Arthamid? Are the specific joints that do better with one versus the other? Also, can they all be used in the neck?
So how do I decide what to use? It may depend on the age, metabolic status of the horse, what the trainer and or client owner wants, what we feel is going on, if it's acute or chronic, and then what's coming up on the calendar. How serious is this? Is this just some minor inflammation? Do we need to knock it out in 10 days time? Or is this something where it doesn't matter? Let's put something in there that may take 3 or 4 weeks to work, but we would prefer to have them solid over the next 2 to 6 month time period. So all these things, we have different expectations. Many of these are medical devices, and so it's a little bit left to the practitioner and their experience. So the anecdotal experience and testimony on which they recommend and want to apply. Of course, the unfortunate thing with anecdote and testimony is those are the two least scientific ways to apply medicine, but that's what we're left to do on so much of these. So these are the conversations I have daily, multiple times throughout the day, and it really has to come down to what the client's expectations are of the horse, and how, coupled with what I think we need to get accomplished, and then what's in the best interest. I mean, it's not really in that order. It's always in the best interest of the horse, but there's, in the performance affecting joint problems, there are a lot of different options these days. It's more exciting now to tackle these problems than it was 20 years ago. And so it usually starts with a diagnosis and then a big discussion. And that's how we determine what we're going to apply. But oftentimes I am, if it's quite an inflamed joint, then I want to get a response with maybe like a alpha-2 macroglobulin to see if we can quiet things down. And then as I've rarely, but I have had some flares with either PRP products or with the polyacrylamide hydrogels, maybe I want to make sure this isn't a really temperamental joint before I put something like that in there. And then like I said, it just depends on expectations when we need them.
Yeah, no, that makes sense. And just to double down on what you're saying, or to confirm, Tanya asked if any joint injections are proven to work, or, I mean, you mentioned having to go off of like experience, which I think makes sense as well. But are, of the options that you have, are any more or less scientifically researched and proven, or is it something that you kind of gain in your practice through, the different cases that you're working on?
Every case we see is unique, and rarely is it matched up with some study model. The lameness models and the arthritis models are far less usual for direct application from science into what we're seeing in sport horses. Some of them relate a little bit more to the racing world, but regardless, we do kind of lump these joint problems into a high motion joint as a joint when we're trying to evaluate or determine scientific evidence and effectiveness. So we usually it seems like they will focus on a couple parameters, maybe it be a lameness grade or an inflammatory grade, and determine if in a certain time frame this got the desired response or not. And it does tend to be that you have a lot of conflicting evidence where maybe the trainer and the veterinarian thought it was sounder, but the soundness scores weren't any different when we used a certain type of corticosteroid. Others, we have the corticosteroids may be great now, and the anti-inflammatory effects are protective of the joints, but on the microscopic side of things, we're actually seeing some deleterious effects of the cartilage matrix. So it's definitely a balance, and you have seen a big movement. I wouldn't say away from corticosteroids, but a movement into alternative solutions for maintaining these horses for a variety of reasons. And they, as we've gotten into them, most of those have been fairly recently marketed and are medical devices. And so the strong scientific evidence isn't quite there yet. So it's left with, yeah, it's worked on the ones we've, yes, it's knocked down some of the biomarkers in the study, and it works in real life. And it never works until it works on your horse.
Yeah, that's the fun of it. So kind of similar, but Avery is asking, she knows it's been asked a lot, but she'd love your view on joint supplements for prevention and what you would recommend to help prevent joint issues in a healthy 15-year-old low-level event horse.
I think at that age, I think the hyaluronic acid things go a long ways. There's a lot of joints, especially in the axial skeleton, in the neck, in the back, that have synovial tissue. And I think the hyaluronic acid supplements, whether they're injectable, the injectable ones tend to work the best. Legend is the FDA approved and my preferred. The feed-throughs are absorbed very inconsistently among individuals in this species. So it's, if you find one that works on your horse and you feel like it's providing some support, then stick with it. But you probably won't get a lot of recommendations from me because there's not a tremendous amount of compelling proof that a lot of it works across a lot of horses. The glycosaminoglycans are good, but I think those are less relevant at the cartilage level in a 15-year-old, and probably more, if you connect the dots a ways out, they can have some benefit to other soft tissue structures such as tendons and ligaments, the glycosaminoglycan component of it. Pentosan has been around a long time. It's kind of come in and out of availability. And I believe there's a very recently approved, FDA approved product that will be available. But when you're giving things, especially when you're giving things electively to your horses for supportive care, I have gone more towards the FDA approved products over my career and away from the compounded products unless I just feel it's my only good option. And most supplementation is elective, so take that in consideration.
Yeah, that's interesting. And I mean, Avery's in a good position. I love to hear about a happy, healthy 15-year-old event horse and like being able to just support him or her. Okay, I'm going to take us to some questions that are a little more like lighthearted or less kind of in depth on a specific thing. And I'm interested to hear what you have to say. So Kara asked, if we, as clients, notice some heat or swelling or sensitivity in the leg, should we rest and cold hose for a day or two? Or when is it the right choice to call a vet right away? She said, I hate to overreact and bother the vet unnecessarily, but I also don't want to let something get worse if I delay the treatment.
Some of the most minor swellings can be quite serious injuries, and oftentimes the biggest swellings are not much at all. It just depends on how comfortable you are in understanding the anatomy and what's important and what your horse is doing. And if you had a cross-country schooling yesterday and you have a subtle swelling and some heat around an ankle, then maybe you should worry. And you can call your vet, talk about some anti-inflammatories and a game plan, and to come out and maybe diagnose the problem. If it's a 15-year-old that didn't cross country school on Saturday, but has been turned out for a year, and we're just thinking about getting into eventing, and he came in with a huge leg and is non-weight bearing, then call your vet. It may be terrible, but it's very likely something that's very minor. It just is very painful to the horse, whether it be a foot abscess or something more minor that doesn't have quite the long-term implications of a soft tissue injury. So it has helped a lot with people sending pictures. Having, you have a working relationship with your vet. They know what you do, they know what your horse does, and they know your knowledge base. And so I think it's easier these days to at least get a plan sooner through telemedicine and pictures and conversations with someone you have a good veterinary client-patient relationship with, and that may prevent some distress for you until they get out there.
Yeah, I think that's like every vet I know is like, oh, just send me a picture and like I'll take a look. And it's like, do you ever not accept like pictures? Like, I don't know, like, do you ever actually shut off and be like, I am done working today? Or are you able to like actually take vacations?
Yes and yes. So we're going to group practice, so that definitely helps. Getting back to how I got into this, my dad is a solo practitioner, and that's a totally different lifestyle. Group practice, it helps me go do other things veterinary-wise, away from my immediate practice range, and it also has helped me fit vacation time in for the family through the years, more so now than early on, for sure. Availability is important, especially early in one's career, but family is important too. So as the kids get older, I need to make sure I'm around. So yeah, we go on vacation. I do get away, probably may not be as available as some of my local clients would like, simply because sometimes we may be in Kentucky for 2 weeks, we may be in New York for a week and a half, we might be in Maryland for 2 weeks. So I'm not here, and if I'm not here, then I might as well be nowhere. And so, but I would say the pictures, texts, that has helped a lot. It helps us kind of quarterback, especially within our team, on how we can maybe offer a seamless continuance of service without actually being required to see the horse in person, and then check up as soon as we get back.
Yeah, totally. I'm glad that you are able to have some work-life balance, because it's so important, and you work so hard. So kind of similar. Shannon is asking, she said, if you're a veterinarian trying to be a rider, how do you turn off your veterinarian brain and just ride and have fun? She's not sure if you're able to address this, but she's curious what she says because she went to vet school with you.
Oh, excellent. I don't ride. I mean, I rode as a kid just for fun, but I never did anything competitive. I always came at it from the veterinary aspect. So I don't know how you turn off the vet side of things and go ride. Yeah, I clearly have my outlets, and it's probably the same. You get away from the phone for a period of time, and then when the phone's there, you respond. But you definitely have times when you're available and times you're not. As far as the rider psychology, I find that very interesting to see and recognize, especially when clients get closer to a big competition that they've been preparing for. And it's my role to identify problems that we can fix, and to maybe identify problems that are just in their head, and you've got to plow through, and this is actually no different than it's ever been, or this is a specific thing. It's not affecting them. You can't let it affect how you ride this horse because it will affect your performance and the outcome. But that's definitely rider psychology and gets back to having a strong core of including a very competent professional that you have a good working relationship with.
I hadn't thought about that, about how the things people are concerned about kind of vary or shift if there's something high pressure coming up, but it makes complete sense. And I mean, through Ride IQ, we've learned kind of, I guess not surprisingly, that performance anxiety and having strategies to like identify that and manage that is top of mind for almost everyone. Like some of our most listened to tracks are on that subject. So I've said it before, but anyone who does see that in themselves, you're certainly not alone. And you're in good company, and whatever we can do to support you in kind of being proactive and intentional about how you manage that, we want to. So let us know.
Absolutely. I mean, I think mental fitness for your days, whether they be competitors at whatever level, or if you're a weekend warrior, or the horse stays tuned up and you show up and you have to be able to switch away from whatever else is in your life and focus in the here and the now. Definitely some meditation, some yoga, those sorts of things. I think these are our society recognizes these as performance affecting more so now than ever, and I think this is a wonderful direction. And whether you're a veterinarian or a rider being a veterinarian, or vice versa, or a farrier, or a school teacher, or whatever you do, you have to be prepared to focus on what's happening in the present. And so it also, reflecting back on all the text messages and all the pictures, if I'm not responding, it's probably because I'm trying to focus on the here and now, and the horse in front of you, the people that are there, and that's what's important. That's definitely the richest experience you can have, and it's a missed opportunity if you're distracted.
Being present is something that, every day that passes gets harder, but makes life richer in like the social experiences and the career experiences. Like we can't be our best selves if we're pulled in like 10 different directions. Our brain can't focus on 10 different things. But yeah, that makes a lot of sense. So anybody who's waiting on a text from Dr. Mitz, he's doing something good with his time.
I'm trying not to work some horse into a frenzy because I'm not paying attention to them. And if you come in and you're all out of sorts, it will not be easy to get things done around these animals. They will shut you down until you're ready to be around them. They'll let
Totally.
you back in.
Yeah. Okay, another question that I think a lot applies to all of us is a question that Nicole asked. She said, what do you consider the ideal icing protocol? For example, after a strenuous workout, you should ice within X amount of time, or after the workout, you should be icing them for Y number of minutes. And then she asked, what are your thoughts on ice cubes poured into boots versus freezer packed boots?
Probably ice into water is going to tend to be the coldest and conform to the leg and the tissues the best. And air is a great insulator, so any amount of air there is going to prohibit some of the heat being pulled out. You have to kind of balance it. So if the horse is hot, you can't stop and stick them in ice. You need to cool them out. There are some things that you can. There's various equipment that you can apply some ice to horses as they cool out, and they can walk around. Once they're cooled out, you can stand them in ice for 15 or 20 minutes. It depends on how important it is, how much inflammation was accumulated. But I usually defer to the best groom in the barn. They tend to know how long these horses will tolerate and what's best for them. And you can definitely over ice and cause some problems there. So you want to do it at the right time, use the appropriate things, use the equipment you have, and it's usually not the most fantastic apparatus that is required to get the ice on the leg.
I have a quick follow-up question on that. If your horse comes in from cross country and has, a big bump on its leg, or in from the pasture, and it's less of a like workout reaction and more of I guess I'll call it an injury reaction, is that a time to ice right away or not?
Yeah, I think anytime you've got acute inflammation, there's a reason to ice right away. And I think there's more evidence now that there's benefits to icing after you remove the ice in chronic injuries. So it helps the reperfusion that occurs after you remove the ice helps drive neovascularization and blood flow back into these tissues that have had it compromised with the injury. So, but early on, you definitely have a lot of substances released that are causing collateral damage to those tissues. And so the icing is absolutely important. Especially, I mean, most of these things we're talking about will probably be below the knee, below the hock. And that's where we can apply ice the best. Everything else is probably more for us than them. But yeah, do it immediately if they're not in distress. If they're in distress, then you've got to deal with that. Don't worry about icing if the horse is acting colicky because their leg hurts so much. Call the vet. Do what the vet says. If they feel like if they're comfortable with you administering some medications and they're prescribing it over the phone as they're headed out there, then do that. Once the horse is stabilized, then we can ice them.
Got it. And my last question on the topic. So you mentioned like your groom or your coach would be a good resource for telling you exactly what your protocol is and like when to start icing, but you said you can over ice. So like, is there a reasonable window of number of minutes that you have a horse, they're fully cooled down, but they just ran cross country or they did a conditioning day? Is it like be around 10 minutes per?
I think you can probably go longer than that. I mean, I've had horses in ice for 30 minutes. I think it's the day-to-day. If you're icing things for 45 minutes 2 or 3 times a day, and you're on day 5 and you're wondering why they're scurfed, and we created that. And so you can create some discomfort in the horse by compromising their skin as well. So everything within reason. And but usually you're not going to overdo it, especially with ice and water. You're unlikely to overdo it unless you're just going on beyond this 45 minutes. I mean, it's just you're going to be, if you have heat on the leg, then you can continue with that, but you're not going to do a lot of damage. You're just probably not going to do much good beyond that either. It depends. I mean, there are definitely some laminitis is a different animal altogether. You probably just need to keep those horses in ice, and that's under a direction of a veterinarian that is intimately involved with the management of that case. So icing is not a catch-all for everything out there. But the ones you're describing, yeah, if you're in for 30 minutes or so, I think that usually by then you feel the leg, it's ice cold, there's no deformities, no swelling. You're doing them up and tuck them in bed for the night and off you go.
Totally. Is there any world in which by icing them, you're delaying seeing an injury because you've now basically you can't identify the heat because now the leg is ice cold?
Yeah. There are so many injuries that we don't have any leg deformities. Deep pseudo flexor tendons, proximal suspensory injuries, many structures within the pastern we won't see or won't until you clip it up and look a little closer. But so you're not going to change the ultrasound that much if it gets to that point. If you feel heat, then ice the leg and call the vet and see if they want to look at it based on what the horse has done and what you're describing. But I wouldn't worry about icing to mask or prevent something unless we're using it inappropriately, too close to immediately doing a hard run around cross country.
I love this. It's like all the amateur anxieties that, because we don't always, I mean, it's kind of rare to have the opportunity to just ask a vet, like this is the anxiety I have. Tell me if it's reasonable or not. Okay. So Laura said, I'm curious about Dr. Mitt's take on managing the Lyme positive sport horse.
So Lyme is very mildly endemic, if at all, in Florida. All of my Lyme cases have probably had exposure and were acquired elsewhere in the country, especially New England. And I manage a lot of them when they're down here. We don't tend to see these. We're seeing some performance affecting issues. Maybe these horses are quite backwards, but they're not as acutely and severely medically ill as I have heard from those when they're up in Massachusetts, New Hampshire, wherever. So how do I manage it? I tend to go based on clinical signs, coupled with a multiplex titer and a course of tetracycline of some sort, depending on how effectively we can administer tabs, caps. Do we feel like we need to do injectables? There are a lot. I mean, the Lyme's thing is definitely, I'm led around by my clients that go up there and work with the practitioners in that area. And there are some things that they use to help maybe with the immune system, and maybe these things are kind of non-medications or more in the supplement category, that aren't over the counter, or they're just not, there's not a lot of evidence, but anecdotally for them, it's helped a couple horses. But Lyme, to me, is a very complex, enigmatic condition that probably early identification is important, but too often you're not eradicating the bug from the horse, and you're managing these horses periodically through their life. So I don't, it's a lot of minocycline or a lot of doxycycline in these horses at this point, because I don't have the cure, but that definitely helps them.
Yeah, if only we had the cure. That would be helpful. So Ella's wondering, and I know this, like, we're coming up here on the hour, so this is probably our last big question, but Ella is wondering, what are the long-term implications of a dropped hip, and what are the best ways to manage this long-term? I have a 16-year-old PSG gelding who is sound but stiff. We are starting to look into further management of his dropped hip, so any info is appreciated.
These could be old healed fractures. These could be chronic lamenesses. These could be to the point where it's a chronic limping lameness, or it's just a chronic kind of sore. Don't use my hip that well on that side, so I don't have quite the muscle mass. All those things are kind of get lumped in there as a dropped hip. It definitely starts with a lameness exam, flexions, gather some history before all that. Go over the normal bony reliefs that we can palpate. Those are strong insertion points for big muscle groups, and they can wonk them and fracture them. They can have a strong muscle contraction that can pull pieces of bone off, and that can change the anchoring points and how these muscles appear, but it may not affect how they function. There's others that have chronic lamenesses that need to be diagnosed and addressed properly, and these horses will be non-performers until that's done. And then there's chronic arthritic conditions that can create this, and they may need to just be addressed more effectively, and it seems like we do that more now than we used to. But so the drop tip is a complex presentation, and maybe in younger horses it's transient, especially if these muscles or the injury heals itself and they re-coordinate their muscular requirements to ambulate. And so they may maintain this drop tip appearance, but it might not actually affect their performance.
Interesting. Well, we got through a lot of questions from people there. So thank you for taking those as we threw them at you. I know it's a lot.
You guys are great. The questions are great. I definitely appreciate such the loyal base of the eventing nation and the adult amateurs and professionals alike. So it's a great passion you guys share, and I'm so fortunate to be a part of it and to help you guys with it.
I love that. Before we go, a question came up in my head when you mentioned that you have kids. Do you think how many kids do you have, and are any of them expressing interest in following in your footsteps?
One of my friends is in the hunter pony world,
Uh-oh.
and I've displaced the broodmares and weanlings and yearling thoroughbreds with we have a small and a couple mediums, and I mean I have a 6-year-old, and she started riding. The other one is 3, and she's not riding just yet, but of course it's an affliction, but at the end of the day it's a far better affliction than some of the other things in our secular world. So I think that I would be thrilled to see them get into it, and we'll support them every way I can.
Did you just say you have 3 ponies?
Well, so some of them are for me to fix and some of them are for me to have. So yeah, we're riding one, and sometimes once we tune one up, we see how he goes, and so there's lots of opportunities to get on ponies. That's the stage my family's in right now, and obviously that doesn't tend to last forever. We have to grow out of that, but it's a lot of fun at this point. And from a veterinary standpoint, I just love watching sound horses and sound ponies do their job. We're not trying to give them a problem. They're out there performing, loving it, and making a life for those that are involved.
Yeah, it really is. I can't help but smile watching happy horses at any level and happy riders, and I'm sure you're the same. Well, thank you so much, Dr. Mitz. Again, this has been an hour full of I learned a lot about horses and about being a client of a vet, and some of those anxieties that I mentioned. So thank you so much for addressing those and for helping us have a little bit better of an understanding of the horses that we want to do right by.
You guys are great. Thank you so much.
All right. Have a wonderful evening. And that goes to everyone watching as well.